Hi, Dr. Ryan Lewis, DC here. Simple question. What is neuropathy? So, yesterday, if I reflect, the reason I'm shooting this video is because I think there's still some confusion about what neuropathy really is. So, I'm going to give you clarification really fast. So, this is going to be a fast video. Even if you think you're sure what your neuropathy is, I encourage you to watch to see if you just pick up anything new. So again, this is going to be a fast video. My goal is to give you real clarification, especially if you're unfortunately living with this. So, what is neuropathy? This was inspired by, if I look at the last couple new people I saw in the clinic yesterday. So really smart people. So this is not an attack on anyone's intelligence. Is how would you know? Why would you know if someone or your healthcare practitioners haven't taken the time to properly explain what neuropathy really is? The reason you would want to do this is the more you know. If you just know the basics, let me backpedal on that. I mean, I just had that that commercial that's on usually on like Sunday morning. It's like a public service announcement commercial, usually with a celebrity that says the more you know, and they tell you some trivial fact that's interesting. So if you're watching this is probably going to be more than a trivial fact and more than something that's just interesting. But anyway, if you know the basics, you're going to have a much better chance of managing your neuropathy or your balance so they don't get worse. For some of you, you'll be able to use this information and get some better. And then there's those that will just that will be able to just manage. I say just, I'm not comfortable with that because how big a deal would it be if you could just keep where it's at from getting worse? That's you have to be intentional. If you like things the way they are, I have to remind you, only half of the people have pain with neuropathy. And it's very deceiving. It's unsuspecting. If you don't have pain or what you would consider pain, you have mild symptoms, do not be fooled. Only half of the people with neuropathy have pain. So pain is not an indicator of the health of your nerves. It's an alarm system for half the people. I digress. Back to the original point. What is neuropathy? You'd want to know this because it gives you a better chance to manage it. Bottom line. I'm not going to make you into me. I'm not going to try to. I'm just going to give you something simple. I'm going to give you clarification on this. So I hope you enjoy it. The last couple people I saw yesterday was just the last two, and it just dawned on me yet again. I mean, I've had thousands, literally and actually thousands of encounters through the years, more than a dozen years of nothing but neuropathy. Nothing but people that have neuropathy and balance problems. Okay, so this is just from here and here. I just want to give you something that's useful and helpful. In my experience, most people aren't told exactly what it is, and then they don't have the raw material to do a better job managing it on their own. So let's see if we can help you with that some here. Let me advance this slide. I don't know what's going on. So most people aren't really sure exactly what it is. I don't think it's discussed. And big part of that is the obvious, the therapies that work the best, not just my opinion, the therapies that have the most research on them are not mainstream medicine. Okay, so that's not my decision, not my choice. There are plenty of therapies that are mainstream, but I think most of them aren't. So for example, the one out of the two, so again, 50% of what I'm reflecting on, persons yesterday, the one person says, because they drove an hour one way. So they said, I've been told that there's nothing that can be done. I'm not I know everyone has smart and caring doctors, so I'm not suggesting otherwise. But they say there's nothing that can be done. I just encourage anyone to, unfortunately, you have to be an advocate for yourself nowadays. So just Google, just search up anything that I'm telling you on this video or any other videos, and you'll see that I'm telling it to you straight. So anyway, I don't think it's discussed enough. I know it's not discussed enough. You know it's not discussed enough, or you wouldn't be watching this video. There's plenty of research. There's a ton of research. You don't need to do the research unless you just really like it. I do still do research, and I put it out there just like this for you guys. Or this isn't necessarily research. This is just trying to be helpful so you have a better perspective, a perspective that could help you keep your quality of life or keep your independence. So we'll jump into that briefly. So I just want to give you some good clarification here. Again, watch for the next couple minutes. I think you're going to pick up something that you didn't know, no matter how long you've had neuropathy. The person I'm thinking of yesterday, they've had it for a decade, easily a decade, but they reported that long too. So you can prove. You can take this information, you can prove it. So here's the deal. Here's what you want to know, because it can get confusing really easily. Take the word neuropathy, cut it in half. So you have neuropathy. Neuro means nerve. Pathy means abnormal, disease, or damage. That's it. Take the word neuropathy. It's neuropathy. Neuro means nerve. And in the pathy, the end of it just insinuates, it says, hey, we have something abnormal. We have a disease state. We have damaged condition. You have nerve damage. So all neuropathy really means is nerve damage. You have nerve damage. Doesn't matter if they're saying you have neuropathy, peripheral neuropathy, diabetic nerve pain, nerve damage, nerve pain, mononeuropathy, polyneuropathy, idiopathic neuropathy. We're all idiots. We can't figure it out. Or the other dozen names of the condition that I didn't mention. For your purpose, for management, it's that you have nerve damage. That's what you really want to take away. So they'll name it for, and rightfully so, like other ailments in the human body, they'll name it for the tissues it affects or the causative factors or how many, like so mono versus one, poly, many, diabetic neuropathy, it was caused by diabetes. So they name it for, again, usually the tissues that are involved or how it's caused. Neuropathy just means nerve damage. Peripheral, okay, because this is probably the biggest confusing phrase. People say, I don't have neuropathy, I have peripheral neuropathy. I don't have neuropathy, I have diabetic neuropathy. Okay. Peripheral just means outside from the center. So think about everything in the middle of your body, things on the outside. Your extremities, your legs are outside from the center. Most commonly legs and feet. So look at this diagram just for a moment. You have your central nervous system. So look at the diagram. You have the top, the brain. The brain goes down to the brain stem. The brain stem goes down into the spinal cord. And the offshoots of the cord there, so the nerves, the tributaries coming off the cord are your peripheral nerves. So if you look to the left side of the diagram, it says peripheral nervous system. Look at where the line is going to the bottom. Those are the nerves that are coming off the spinal cord in the lumbar, your low back area. Those are the nerves going down your legs and your feet. So you have peripheral neuropathy if it's in your arms, hands, legs, or feet. Make sense? So neuropathy just means nerve damage. Peripheral neuropathy just means your nerves outside from the center of your body are damaged. And again, another extremely popular phrase for the nerve damage would be diabetic neuropathy. And of course, that just means your nerves are being damaged by the underlying metabolic condition of diabetes. Okay, so when I say the word just in all these slides, that just is not a code for minimizing any of it. And I'm certainly not making you wrong. I just want to give you a better or a basic understanding. So again, you'll have a fighting chance to better manage it. So for people who suffer from numbness, tingling, burning, sharp, shooting, electric type jolts, you get muscle cramps, usually described worse at night. Coldness, which I didn't put on this slide, but cold is a big one. Usually also described worse at night. You feel like your socks are bunched up under your feet or you're something in your shoes and there's not when you go to check. You have restless legs. Again, that's part of neuropathy, by the way. And again, usually described worse at night. Not everything is, but a lot of symptoms are. So, but let's not get hung up on the timing. That would only be important and for future conversations. Balance problem. from the nerve damage. You have nerve damage in your feet. Not being a pessimist, this video is not about the balance. It's about what actually is neuropathy. It's nerve damage. But your balance, always my biggest concern. Luck runs out with falls. They're at some point, unfortunately, can be really serious. Any of this rings a bell, rings true, resonates, sounds familiar. If you're not sure, it sounds like you probably have neuropathy. I'll tell you what to do. You want to reduce the pain, the symptoms, the burning, the tingling. You want to have better feelings so you don't have as much numbness. You want to be able to drive. You want to be able to walk, better balance. Sleep through the night. A person yesterday, of the two that I'm reflecting on, the two new ones, the one person said, what's your biggest concern while you're here? Actual legitimate question, because there's a whole spectrum of neuropathy. She says, really, I just want to be able to sleep through the night. Total understand that. I hear it all the time. How do you do that? Improve nerve function. We'll dive into that. There's another video. If you like any of this or find it interesting or you just want to know more, you can go to another video that I recorded that's longer and much more in depth. A little bit longer, probably about 20 minutes total. It's at www.fixfeetstl.com. So that's fix, F-I-X, feet, S-T-L as in St. Louis.com. So consider getting a more revealing test. If we're sticking with the basics, okay, now we have good clarification on what neuropathy is. So now what? Well, I had a test, or my doctor said, fine. That's really all you need. But if you want a more revealing test, a test that would give you insight to if there's indications of therapies that could be useful with your condition, the type of nerve damage you have, get a QST. By the way, you can also use the QST, which the other tests that are widely done, most commonly done, you're not really, what I'm regurgitating research, not my opinion, but I would also agree with this. You're not supposed to use it as a clinical progress marker. What does that mean? Well, once you have it done, it's for diagnostic purposes only. You don't need to do it because there's too much reliability called into question when you repeat the test year to year, every 6 months, whatever the case is. So not saying don't get it. Follow whichever doctor that you're listening to, follow their advice. I always use QST, recommend a QST. It's not painful. It's extremely revealing. And it, again, can indicate if there's therapies that could be useful, if there's clinical research, clinical trials, medical research on therapies that could help your condition. That's why I use the QST. I think everyone should have it done that has any of the symptoms, or even if you know you have neuropathy, you should have it done once a year, because it can tell you, it can really give you a comment on the status of your condition. Are you actually getting worse? Why guess? Why wait till you know you're having missteps, or you get scared because you thought you were on the brake, but you weren't on the brake pedal? Or you find yourself, bro, your foot's slapping, you're braking hard, you're, not sleeping. Why wait? These are simple, non-painful tests. So, but of course, I'm biased. This is all I do, and I see it through a very. It's just real. Hopefully, I'm making it simple for you folks because I think it could be helpful. So this is a test I use. You want to go from unsteady and painful and feet and not sure about your balance. You want to be more secure. You want to be sure-footed. You want to be more energetic and active again. A couple months, who knows? People are going to be able safely to get out more. The spring is coming. Sun's out. So you want to be more energetic, have a better quality of life. Get the QST. Dr. Ryan K. Lewis, DC, Missouri Pain Treatment Center. Go to www.fixfeetstl.com, and especially if you want to know more, you like this video, reach out to me if you have any questions. Take care.